Hello, I'm Dr. Hakim, consultant orthodontist, diplomate in the American Board of Orthodontics, and I'd like to welcome you to our final episode in this series of podcasts. Today, we're going to tackle the very significant question of retention. What do we do after we've finished orthodontic braces? So we need to hold it. So welcome to our next episode, and see you. So welcome back, and thank you for all the feedback we've been receiving. It's been amazing, and we really didn't expect to be received in such a way. We look forward to getting all of the information and all the feedback that you've been sending us, all the questions you have, and this will help us with our next season's podcast, which will be coming soon. So today, we're going to talk about what we do after we finish orthodontic treatment. We've already discussed interceptive orthodontics, and that is orthodontics that is done while we have baby teeth. We have the members of the panel, Dr. Ana, if you remember, and Dr. Omar,
Hello.
and even myself, where we've had orthodontics as adults. So why is that? What's going on? So today we want to answer. So tell us, we're going to start with Dr. Omar, who had orthodontics as a child. He's had it 3 times. So tell us what happened and what's the big deal with retainers?
All right, so I think retainers always has to be emphasized from the start.
Yeah.
It's very important.
Okay.
Take me as an example. We did round 1. Round 1 was interceptive, and this is questions we get. We finish interceptive treatment, we give a retainer. Now, why do we need retainers? We give you the retainers. We would like to hold the correction that we've done in place if we started at an earlier age. If we've done interceptive, that was needed at that age. We hold any correction we've done, and we monitor growth. We all grow, we go taller in height, our hair color changes, tissue strength changes, so teeth still want to move with time. And I believe it is around 0.2 millimeter a year?
Yeah.
That's the number we wanted to see as an adult. So retainers, you wear them to control or to prevent the teeth from moving after the correction that we do, especially because it does take time for the tissues and the bone to remodel to the new position after moving teeth. And like we said, to control any age-related changes. So I've done the first phase with those removable expander, had the retainer in place to hold things before it was ready for braces treatment. I did braces extraction treatment, things look great, but I'm someone who, when he got his fixed retainer, kept breaking it, did not take care of it. And after that, my orthodontist did provide me with a removable retainer, and I ended up losing it and never went back to replace it. And here we are, 20 years later, and I'm getting 3rd round of orthodontics. So retainer is key if you want to preserve your result. We do it with our cars. We take them to service every few kilometers that we drive it. We go, we check on things. Your teeth have to be maintained and checked on. So you get a retainer, you wear it, and you review with your orthodontist. Okay. For people, I'm sure we get questions asked, like I mentioned, is why when we do the 2-phase orthodontics, we do phase 1, give them a retainer, but then even though they wear it properly, they come when it's time for phase 2, they ask, why are we doing phase 2 orthodontics? So what do you say about that, Dr. Hakim?
Yeah, with whenever we do interceptive orthodontics, we have a specific justification, like we mentioned. So our goal in that treatment is to eliminate the justification. So if we said, let's say the position of the teeth increased the risk of damage due to trauma, or increased risk of damage due to trauma. If we bring the teeth into a safe zone, that's the treatment finished, regardless of what else is there. Because the goal of interceptive orthodontics is to really be done as quickly as possible. Now, in certain conditions that are growth related, treatment time may be prolonged. But at the same time, the type of treatment should be such that the child can tolerate for longer. So if we eliminate the justification, we need to hold it, like you said. And then once the patient is ready for, or once all the deciduous dentition is gone, then we need to reassess, because sometimes the teeth do erupt in an unfavorable way that doesn't signify or doesn't warrant interceptive orthodontics, but later as comprehensive, it would be required. So that's one. The other thing I mention is, whenever I'm asked about retainers, is that if you go and work out and go to the gym and go on a diet and you achieve your health goals, do you then stop?
Yeah,
Nope.
that's right.
And the
No.
answer is no. So at first, to reach that goal, you may have to put in more effort. But once you're there, you have to hold it. You have to maintain it. So it's the same principle. In life, biology is the same, whether it's for your abs or for your teeth.
Yeah.
Once you achieve that goal, you have to hold it. And that's why I think retainers are very, 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 very important. Now, for you, Dr. Ana, you're currently in retention.
Yes.
So could you
second
share with
time.
our audience what retainers you're wearing and how you're coping with them?
Yeah, so in my case, actually, one more, while you're talking about that, I was thinking, because many patients, they do ask, oh, but I know someone, or I'm the case that I finished the treatment, I didn't wear any retainers, and I'm fine. We don't know, we cannot predict that. So that's why some patients, they're lucky and they have that. Some patients, they are not. I'm not very lucky, because actually my case, again, as I said, it was very simple, but there was some rotations on my lower teeth. I had fixed retainers for a long time, and as soon as I had them, they were broken. I think maybe 2 weeks after more than 10 years using the retainers. So we were past that time that you spoke about the biology and everything for the fibers to reorganize, and my teeth moved. So this is something that we cannot control. What we can control, again, with the retainers is the movements that we fix with the braces, with the aligners, plus the movements that will continue to happen until the rest of our life. So when the patient asks, how long should I use? It's for life. Of course, it's not the same. We're going to be doing follow-ups. We're going to be checking on them. We're going to see the need of doing a new one, removing maybe the fixed one if you're not in the mood anymore to get the fixed one. But you should always have something to hold. You want a fit body, you want nice teeth, so you have to, exactly, it's the same. So we have to take care of that.
I think a key point you mentioned, and it refers to all the other episodes we talked about, every patient is different. So like you said, if your friend had a fixed retainer and it worked, or your friend didn't have any retainers, well, again, what was the presenting malocclusion? Did your friend have spacing? Did they have rotation? Was it just very simple crowding? The degree of correction we do warrant different type of retainers.
Yeah.
So that's it. Like we just mentioned, type of retainers. So what are they? What can we do for patients?
Yeah, obviously there's the fixed retainer, there's a removable retainer. The removable retainer can take different shapes. There's the traditional plastic with the wire. It's called the Hawley retainer. Yep. We'll be sharing a picture of that.
Very famous in Brazil, that one.
And they were very famous for a long time.
I had that first time as well, the Hawley.
But the disadvantage here, it can be uncomfortable after a while. Plus, the wire can actually be bent out of shape.
Exactly.
So now the more accepted removable retainer is commonly called the Essex retainer, which resembles the aligner. It looks like the Invisalign aligner. And whenever I prescribe these to patients, I would make several. I don't just give them one if it's a removable retainer, because if they lose it, then we're going to be in trouble.
Yeah, actually, I was going to ask, what is the protocol that you usually do for your patients? Of course, as Dr. Omar said, it's specific for every patient, but what is the protocol that you usually...
Well, generally, if the patient, it depends on the case. So there are certain types of teeth arrangements that once corrected are going to provide a big challenge to keep in that position, and that is rotated teeth, severely rotated teeth. It can be open bites as well. So if the teeth are not together, there is a tendency for that to relapse too. So if I anticipate that we're going to face a challenge keeping these teeth in position, then I would use a wire retainer, a fixed retainer for at least a year.
Yeah.
But I also always give a removable retainer.
Okay.
Always. In the presence of a fixed retainer, it means it acts as a backup. If there is no fixed retainer, I give 2 to 3 sets of removable retainers, and then I ask my patients to rotate them. Because if you just wear one, then with time, just like with any item that you wear for a while, there is going to be some stretching. And then if you then transfer to a new one, it's going to be uncomfortable. So I tell my patients to rotate them on a monthly basis. So they'll have 2 or 3 retainers, usually 3, and then they will rotate every month. They will wear one, and then by month 4, they go back to the first one. And then that way, they can last a very, very, very long time. It's not something I made up. It's what I picked up from the sports world. If you look at athletes, if you look at whether Novak Djokovic is on the tennis court, he's got a very big bag and he's got multiple rackets. If you look at the baseball players, they have multiple bats. And that's why football players have multiple boots and runners, because if they're constantly using it, it's going to fatigue and it's going to more likely break. So that's the protocol for the retention. And we obviously we have patients who are in retention now for many years, and they're very happy with holding their results.
So you've mentioned about the removable retainers, how they recycle them, how we take care of them. I know, as I said, I was someone bad with this fixed retainer, kept breaking it. I think you're doing better than me. I know, Dr. Ana, we've placed a fixed retainer for you. It's there. For me. But tell us what then care does patients need to do with a fixed retainer? Is there anything specific needs to be followed or to be aware of?
Yeah, of course. Like whenever I recommend that, it's either with some specific indications, like rotations. We do know, especially the lower teeth, the front lower teeth. So in those cases, I indicate. But of course, I also check how is the oral health of that patient. So if I see that the patient is struggling with the cleaning, maybe a fixed option, it might not be the ideal, because of course it adds up a little more extra care with that. And again, as you said, it might break. So this is something we need to take into consideration. If the patient is not living here, which we have, maybe if he doesn't have anyone to address that wherever he is, we have to think also. And again, we always ask the patient as well. Sometimes the patients, no, I think I want that. He knows that maybe he's not going to be the best one with the removable at night, so we can give something extra. So I think all these points are the main ones that I usually check before deciding with the patient and with the case.
I think, like patients, they need to clean it properly, maintain it. When, of course, they go, like we said, see the dentist. We don't forget about them. When you go for a regular cleaning, they can check the retainers for them. Like, and if they flag anything, if they don't repair it themselves, come back to see us. We advise every time you do your cleaning, come back and see us. Like, it should be on parallel.
And I think it's very important to stress that we tell our patients to get their dental exam and hygiene visit before they come and see us. Because if anything is flagged, they let us know. And sometimes by accident, during the cleaning, a fixed retainer can be broken. So it's always important, to visit the orthodontist after you get the dental check and the hygiene visit, because it's very important to make sure that these retainers, once in, stay in to do their job and to hold the teeth where they need to be.
I think we want to hold it, because what might be a sore topic or something to mention is age catches with all of us. I think teeth will want to move at the end of the day. So you want to keep your result for a long time, just wear it.
And make sure that the patient understands that it's not because you finish with your fixed braces or your aligners that the treatment is done. You
Yep.
put the retainers and then you disappear. No, these follow-ups are really important. We can track the oral health, and we can track also the teeth movement. So I think it's a win-win situation.
Absolutely, and I think for all of us, if we view, once the orthodontic treatment is finished, once that initial period of settling takes place, which is in the literature, it's 273 days, but let's round it up to a year. Beyond that first year after the completion of orthodontic treatment, if we view our retainers as an anti-aging device, then I think we'd all be more motivated
Yep.
to keep up with it.
Botox.
Yes. Well, yeah. No, that's a different
Kinda.
subject.
Yeah.
Maybe for season 2. So
Every 6 months, check up.
and they're happy to do that. But yeah. So again, I'd like to thank you. I'd like to thank my colleagues for joining me on this fantastic journey of our first season podcast. Would like to thank you for tuning in and for checking out. Please, please, please keep that feedback coming in. We want to get ideas for season 2, and we value everything you might have to say. So once again, thank you, Dr. Omar. Thank you, Dr. Ana. And thank you for tuning in. And always remember, don't just smile, smile healthy.